Staff at the St. Elizabeth East Emergency Room have had a little more than 2 months to adjust to the challenges posed by the closure of the central location's ER. News 18's Samantha Tiki reports on how the hospital is dealing with the challenges of having one less emergency room in the area.
It's been more than 2 months since the doors closed for good at the Franciscan St. Elizabeth Central Campus's emergency room. And although patient volume has increased, Franciscan St. Elizabeth Health CEO Terry Wilson says he's standing by the decision.
It was becoming much more of an urgent care kind of a patient volume, and the numbers were declining. This was absolutely the correct decision for us, and it was the correct decision for the community.
But Wilson says the consolidation hasn't come without challenges.
How to maintain the facility when it's that much busier. So you beat it up more when there's that much more traffic. You have to reevaluate how you clean it, how you maintain it.
Wilson says the patient volume has increased 50% since September's consolidation, and he says the last 2 months have been a time for staff to learn how to deal with the increased numbers.
Simply learning the logistics of managing a patient volume that's 50% larger than it was before you did this. That's been a big challenge. I think we planned pretty well, but we learn daily about how to do a better job for people.
According to Wilson, an urgent care clinic within the ER aims at getting more ambulatory patients through faster. But he says the staff is still learning the best ways to get patients through the ER more efficiently.
We have had some cases that have taken longer than we would have liked, and that has to do, again, with the learning to schedule and to staff differently.
Wilson says in a small number of cases, patients were sent to another hospital, either because of clinical need or how busy the emergency room was. But he says it's not an uncommon scenario in any hospital.
It happened before we did the consolidation. It has happened since we've done the consolidation. But again, we get better at managing the rest of the hospital at a much busier level as well, too, as we move on here.
Wilson says discussions have already been taking place on the future of both the Central and East locations and the property recently purchased on State Road 231 and Cumberland Avenue. He says he hopes to know more about the future of that facility by early next year. Samantha Tiki, News 18.